From SiriusXM's Doctor Radio, this is Coronavirus. Everything you need to know now.
From Doctor Radio Reports, here's Dr. Mark Siegel.
Today, we're focusing specifically on back to school. And why are we doing that? Well, first of all, it's related to the pandemic, isn't it? And so we're going to focus on aspects of the pandemic that relate to schools reopening. And we have some great experts for that because it's been in the news, but it's really a medical issue. The medical issue has to do with a lot of things that are flying around that I'm going to talk about. Psychological impact on kids that have been out of school, that have been learning remotely or maybe in a hybrid situation, the issue of vaccination, the issue of mask guidelines that have come out. The American Academy of Pediatrics came out with new guidelines over the past 24 hours about masking. All of this has raised a lot of confusion. Now, I talked to Dr. Danny Benjamin the other week about the issue of schools and spread of COVID, and I'm going to probably start by framing that with some points he made. He said 3 main studies, one in North Carolina, one in Nebraska, and one in Utah, showed that the chances of secondary transmission from kid to kid, if a kid is positive at a school under the age of 18, was less than 1% or about 1%. But he felt masks were probably the main reason for that. Even though he didn't have a control group, he compared that to Israel, where it was like 20% without masking. So that's probably where I'm going to start today. I'm lining this up for my first guest, Dr. Jennifer Leiter, who we've had on the show before. Dr. Leiter is Associate Professor of Pediatrics and Pediatric Epidemiologist at Hassenfeld Children's Hospital at NYU Langone. She helped guide us, by the way, through the pandemic in a way that you may not realize. She also was involved with deciding who qualified for monoclonal antibodies. So she's a pediatric infectious disease specialist, but she also has worked with us with COVID on the adult level. Jennifer, welcome.
Hi, thank you for having me.
And also Dr. Chanel Coble is here. She's an assistant professor of pediatrics and adolescent medicine specialist at Hassenfeld Children's Hospital at NYU. Dr. Coble, welcome.
Thank you so much for the invitation.
Jennifer, I'll start with you. Weigh in on what I just said. It's a huge can of worms, isn't it? But I think I set it up well with Dr. Benjamin, who's a great researcher from Duke. What do you think about the idea of secondary transmission in schools of COVID-19 and the role that masks play?
So transmissions in schools over repeated studies have shown time and again that they are rare events, and they do not increase the COVID infection rates in the community. So it is important that, schools are deemed essential institutions and that in-person learning occurs starting, in September when schools open. Transmission, the reason why schools are so safe are because of all the mitigation strategies that are put in place, but also the monitoring of those strategies, right? Because, the staff is constantly, adhering to the protocols and ensuring that the kids are as well. So schools are actually one of the safest spaces, and, analogous to hospitals, we have all these protocols in place to make sure that our patients and staff stay safe and that transmissions, are minimized. In addition to the studies that you cited, I do really appreciate the study that came out in the MMWR, which is the CDC publication that looked at Mississippi school children and found that children that were in-person school had lower infection rates than children that were actually hybrid or learning from home. And, I found that quite amazing in that, school was protective against COVID. And, the reason that was suspected was that children still socialized outside of school, but they didn't have all the safety measures in place that they would have had in school. Schools are safe spaces. I am supportive of the American Academy of Pediatrics guidance that came out yesterday regarding face masks, mostly because, there's no way for some schools to know which students are vaccinated. if you don't know who's vaccinated, you really cannot enforce the face mask. It makes sense that when you don't really know the vaccination status of students and staff to just across the board recommend face masks because they're a low-burden intervention. They may be a little cumbersome, but they're not expensive. There really is no harm. So it's an easy mitigation strategy when vaccination status is unknown.
Let me make this a little bit deeper water. I love where this is going. Dr. Coble, as an adolescent medicine specialist at Hassenfeld, I want you to weigh in, and I'm going to add the issue of vaccines to this. Dr. Leiter was really very articulate on this. There's a discrepancy between the current CDC recommendations and what AAP said yesterday, but of course that may end up changing given the Delta variant flying around and causing all of these cases. So, one thing we didn't get to yet is, and I'm going to go back and forth between masks and vaccines, but I think that Dr. Leiter...
They're really not discrepant because the AAP says when you can't identify which children are vaccinated, which staff is vaccinated, then across the board you should recommend face masks. The CDC suggests, when you do know that someone is vaccinated, they do not have to wear a face mask indoors. So I don't really see them as that discrepant. I think the AAP just gave the caveat if you really can't verify vaccination status, just to recommend face masks across the board.
Fair enough. And I have a feeling, again, CDC recommendations were made before the latest surge of cases or in the middle of it, but kind of before the current last 2 weeks, which have been really dramatic increase in cases because of the Delta variant. Fair enough. Thank you for correcting me, Dr. Leiter. Dr. Coble, adolescents can get vaccinated, and there's been a ton of media misinformation about this. I, for one, am an enormous proponent of all people getting vaccinated that can. I think this is one of the greatest vaccines ever invented. As you know, it's been in the works since the 1990s. I got my 16-year-old vaccinated. I think he was one of the first at NYU to get it of his age because of some risk factors he has. What are we doing? How does that weigh in? So the other thing Dr. Leiter didn't get to yet is I think all teachers need to be vaccinated and all staff need to be vaccinated, and healthcare workers, of course. But if the school is a different place if everybody is vaccinated. What are your thoughts about adolescents, vaccination, and masks?
Yeah, so, definitely to echo certainly the sentiments of Dr. Leiter as our expert on COVID in children and adolescents and adults, we do stand behind the recommendation that together with vaccinating those adolescents and children that are eligible for the vaccine, along with using masks for those that are not vaccinated, really are essential ingredients to making sure that we keep our children and adolescents safe and get them back into the in-person school environment that they so desperately need. We know that, similar to what Dr. Leiter mentioned in terms of the risk of being home and doing hybrid learning actually did not protect against COVID. We know that staying home and being isolated really has been an unfortunate event for so many adolescents and children to experience feelings of loneliness and other mental health concerns kind of coupled along with the pandemic that really have set so many of them on a course for some serious harm. And so we really stand firmly behind the efficacy and the safety of the vaccine in our adolescent and population, and really think that it's an essential ingredient in getting those teens really back into the lives that we know that they need to develop into well-adjusted and healthy adults.
Talk to me about the hybrid model. I have to confess I'm biased because my son that I'm talking about has been involved in a hybrid model at his school, and it's hybrid leaning towards in person. I must say, 70% of it's been in person for the past year. Frequent testing, rapid testing. Everybody's now vaccinated. I didn't see a lot of damage from the hybrid model as long as the hybrid model was 2/3 in person, 1/3 out of. What are your thoughts about that? I'm not the expert.
Yeah, certainly there is more and more data that's coming out, every day, really about, I think, some of the long-term learning implications and social implications from virtual, hybrid, and other models of learning. We know that, for older adolescents, being able to use technology as a part of their learning has often been integral ingredients, but there are some children that really need to be in person and tend to be some of the more vulnerable among our population. Certainly younger children, at least from some preliminary data, don't seem to have fared as well. So some of the early elementary school kids really needed to have that in-person instruction more consistently. And then some of our children and adolescents with special needs, those with learning and other disabilities, that really miss important services that you just really can't do in a hybrid or in a virtual model, may have some more lasting impact. So the data is still being regularly collected to really see, I think, some of the long-term learning and other social impact of the hybrid learning. But I do think there is enough to support that getting children back into classrooms in person really should be our biggest priority for the fall, and really excited with the vaccine and mask and other interventions that we'll be able to do that and send our kids off to school safe and keep them healthy and safe throughout the school year.
Sorry, can I just expand on what Dr. Cole said?
Yes. Yes.
I know anecdotally you had a good experience with your son, but over the past year, I feel like it was pretty damaging to many children not having in-person learning. We now have some data on this. Obesity is up 2% compared to pre-pandemic levels. Mental illness in children that were susceptible is up significantly, something like 80%. We know that 13 million children have food insecurity, and schools, do provide that nutritional health for children. They also, provide, mental and physical access for children in need. It really exacerbated the racial and ethnic inequalities over this past year, because we did see that in wealthier white communities that schools had more in-person learning, and in urban minority communities, they had much less in classroom time. And, there's now good data to show that, in-person learning is much better academically, and learning from home has its own contributed to the detriment of educational attainment for millions of children, and something like 10 million children don't even have access to the internet. So I think anecdotally, it didn't seem that bad, but looking at the national level, I think it did a lot of harm in some ways.
You may not realize this, but I agree with every single word you said, and I've been talking about it for a year now. I predicted this, not that I'm patting myself on the back because I wasn't alone. I called it collateral damage of the pandemic, and I was deeply concerned about everything you just said happening, from nutrition to obesity. Ironically, I would add, of course, if a child gains weight and becomes obese, they are then at higher risk of COVID complications. So
absolutely,
it's a vicious cycle.
It's a bad cycle. Yeah.
My son's school was actually an in-person model, not a hybrid model. But you made another point that applies to that, because it was a rich private school. I think you made a really important point that I want to go into further, which is that his was essentially an in-person experience. Only like when they went away for vacations or somewhere, they would come back first with a week or two of remote just to ease in, and so they could assess the infectious disease risks. I think it was smart. But they had plenty of money to spend on this, and they put tents outside, and they had a tremendous group of nurses, several of whom came on the radio here. But look, you made a really good point about disparity. A lot of the planning, it seems to me, from a health policy point of view during the pandemic was not considering what you just said, that in poor neighborhoods, people they didn't have an iPad, and they were spreading COVID. So talk to me about that further, the risks of kids, infectious and otherwise, being out of school. I like where we're going with this.
I know that children that were from wealthier communities, there's data that shows that they had much more days that were in-person learning. Chicago was closed they didn't have in-person learning for most of the year, and LA and a good chunk of New York City, Detroit, these urban cities, just really didn't have in-person learning. And very young children, need that social interaction. They don't really do as well on the internet learning, and but you found it in adolescents as well that they are much further behind than similar age children that were from wealthier communities that were in the classroom the whole year. Ironically, we made some strides this past year in the United States with trying to work on our racial disparities, but COVID just really exacerbated that issue, I feel like.
I want to follow up on this with Dr. Coble, but I want to ask a very specific infectious disease question of you that you may not have an answer for. I'm gonna throw a hypothetical at you and correct me or agree or just take it your own way, which is the model of how COVID spreads. I understand, and I heard you say you think mitigation strategies at schools had a lot to do with why it spread more in the community, and I think a lot of the studies looked at that issue. I agree with that. I think science shows that. COVID spreads pretty easily, very easily, and hangs in the air. What role does 3 feet of social distancing play versus masking? Is there a way you can make a qualification on what's the most important thing to decrease the spread of COVID in schools?
I think masking, there have been studies that looked at schools that masked and didn't mask. I think you mentioned them earlier in the show that it did make a significant difference. We know that cities that have a strong masking culture, had much less transmission rates and infection rates than cities that do not. So, we know that masks work, and they definitely reduce the amount of virus that is in the air that's circulating near you. I can't give you any hard data to say what is better, masking versus distance. They're both helpful. Unfortunately, we cannot, do 6 feet of distance and expect to have in-person learning in populated urban areas. So the American Academy of Pediatrics, supported by the CDC, suggests 3 feet, and masking is safe, and it is safe.
One study of Massachusetts showed very little difference between 3 feet and 6 feet. Do you think that study was flawed, or do you think that it has to do again with this issue of COVID in the air versus how it spreads? I mean, I'm trying to figure out the science of this. You already said it. You think 6 feet is better than 3 feet.
Yeah, I did see that study. I thought it was a well-run study. They didn't find any difference between 3 feet and 6 feet. It makes sense to me that there really shouldn't be a difference if people are masked between 3 feet or 6 feet. These are arbitrary measures, meaning that we suspect that droplets can't go past 6 feet. But, these are arbitrary lines in the sand. If you're masked, that's safe.
Dr. Coble, this is a great discussion, and I have a caller that's going to get everybody riled up, which I'm really happy about. You can see I thrive off emotion, right, Dr. Coble? So talk to me about the anxiety. And by the way, I learned from Dr. Leiter. I'm telling you, she's. I've talked to her about patients too, and she's amazing, amazing. I wouldn't call her shy, but she's absolutely amazing. So talk to me about the anxiety and the difficulties with the disparities that we've just been getting into here.
Right, and definitely, thank you, Dr. Leiter, for I think such a great segue into really what COVID has done and really highlighting some far-reaching and long-lasting inequities that we see in healthcare, in particular. With limited access to care, to even echo one of, some of the important features that schools serve in the lives, especially of poor and other low-income children, serving as a place for nutrients and food. But even pre-COVID, up to a third of children and adolescents receive some form of mental health services, whether through school counseling, social work, or other psychology at their schools. And so cutting off, that viable outlet for checking in emotionally for adolescents really has allowed, for a complete avalanche of mental health concerns. You can't pick up the New York Times, any given week without seeing staggering rates of anxiety, depression, suicide attempts, actually disordered eating. We've seen, a couple of pendulums with the increase in obesity, but also increasing restrictive eating and eating disorder referrals and intake in our institution and throughout the country. Adolescents that were historically thought to be protected from some eating disorders are now presenting, with, manifestations of poor nutritional intake as a way for them to handle a lot of unmet emotional and other mental health needs. And so, COVID has really, I think, really highlighted, for us in the adolescent community where we need to put our resources in interventions, and in particular, looking at the staggering rates of suicide, as it being, the second leading cause of death for adolescents in the United States, and really, part of a public health crisis as, one of the many unintended consequences of COVID and the prolonged isolation during 2020 and beyond. And so really thinking about schools as well as other community supports and gathering adolescents together as one of those many protective factors to really help a particularly vulnerable group that really is bearing a disproportionate bulk of the mental health consequences of COVID.
Let's go to the phones. Bill in North Carolina, what's your question for our guests?
This is what I want to know is, why doesn't the government just mandate that you have to get a shot in order to go to school, instead of giving it like what some people feel is a scare tactic? And if I can go on that, we have 5 grandkids. Only 3 of them are going to school right now. But actually the oldest one is afraid to not wear a mask around their parents, our daughter and son-in-law, because they're not vaccinated.
Dr. Leiter, that fits into the whole point you were making. I mean, to put that in my sentence, why not mandate vaccines instead of mandating masks for school?
I would love that. So first of all, the 3 EUA-approved vaccines in the United States, the 2 are mRNA and the adenovirus vector vaccine, only have, at this point, FDA, it's called EUA approval. They're not fully approved. We're waiting for them to be fully approved by the FDA. I was hoping that would come by the end of the summer. They've now been given to hundreds of millions of people, and we know that they are extremely safe, extremely efficacious, and, my hospital is waiting for that full approval. Many hospitals are waiting, and I suspect many colleges are waiting as well for that full approval to come, and they will mandate it. I do think it, should be mandated as well for public schools because it keeps those children safe, but it keeps their family safe. It keeps the community safe. So I'm very supportive of that, and we will see what happens with time.
Can you give me a little bit of a deeper dive into something we never talk about here, which is some kids at school are immunocompromised. Some kids at school are at greater risk. We want to protect them, and that is one of the reasons we want everyone to wear a mask if they're not vaccinated. That's one of the reasons we want everybody to be vaccinated, is to protect each other. Maybe we were a little slow on making that public health point because we were waiting to prove that the vaccines decrease transmissibility, which ended up being the case.
My thoughts on that are, I'm very concerned about this Delta variant. It's 2 times as contagious as the Alpha variant. And I suspect if someone is not vaccinated, they will get COVID. They will get the Delta variant. It is that transmissible. And the way to protect themselves from getting COVID is to get vaccinated. The way to protect their family and to protect immune-compromised people that surround them is to get vaccinated. So, I try to use all these rational arguments, fear, as you suggested before, but also love. Like, you love your family, protect your family, get vaccinated.
Protect. People understand the word protect. They don't respond to the word prevent, and they don't respond to too much science. They respond to protect your family and love your family. That's really a good way to message this.
I love that adage is like really thinking about, our shared collective responsibility, not only to ourselves, but to the people we love, the people, our neighbors, our friends, those that we're going to meet, and really thinking about vaccination is not just about yourself, but really about those around you, and doing a greater good for the world we live in. And so everybody can do their part, and just so excited to be a part of, I think, such a wonderful time in public health and medical history that really so many millions of Americans and people around the world have been able to contribute, and hopefully more and more will be inspired after shows like this. So thank you.
Jennifer, let's get back to what COVID does to children and how that's changing with the Delta variant. Is it tilting more towards younger people, or is that just because they're not vaccinated under the age of 12? Only the Pfizer vaccine is approved to the age of 12. We don't have anything under 12 yet. Are we seeing younger children getting sick? Is that the reason? How about long COVID?
Yeah. Okay. I just want to talk quickly about the Delta variant. So the Delta variant, in the New York region is about half of the COVID circulating in this region, but in the United States, it's more than half. And the Delta variant is for sure more contagious. It's about 2 times more contagious than the Alpha variant. The Alpha variant was the strain that was originally from the UK. So we know it's more contagious. It does not seem to be more dangerous than the other variants. But it's increasing the infection rates in people that are not vaccinated. If you are not vaccinated, there is a high likelihood that you will get the Delta variant. It is just that transmissible. There's now more and more evidence to suggest that it is airborne, that it's not really a droplet transmission. If you are vaccinated, it would be exceedingly rare that you would get a breakthrough infection. It does happen, breakthrough infections. When they do occur, they do not progress to severe disease. People that are fully vaccinated that get a breakthrough infection, they don't get so sick that they go into the hospital. They do not get so sick that they die. So there's now good data to show about 99% of the COVID deaths in the United States are in people that are not vaccinated, meaning that we have hundreds of people that are dying every day in the United States, and these are preventable and avoidable. It is very upsetting to see this because it does not need to happen. As far as children, so who is not vaccinated are the people that are getting the Delta variant, or the people that are getting COVID. Only a third of children between ages 12 to 15 are vaccinated, and about half of children over 16 and over are vaccinated. So you can imagine there's just this large reservoir of children, and then no children, obviously, under 12 are vaccinated. There's just this large reservoir population of people that are not vaccinated, that those are the ones that are getting COVID. It's not that with the Delta that it's more transmissible in children. It's just that's our reservoir of unvaccinated population, in addition to the adults that have, for whatever reason, have chosen not to get vaccinated thus far.
I wanted to emphasize the idea that you could have a mild case of COVID as a child, as a young adolescent, as any age really, but end up with long-term complications.
So COVID in pediatrics. So COVID in children, thank goodness, usually does not progress to severe disease. It is very rare when it does progress to severe disease, but it can happen. We've seen about 5,000 children in the United States that had MIS-C, multi-inflammatory syndrome associated with COVID. We know that children can get long COVID. So even though mortality is similar to that of flu in children, we do know that children can still get a chronic course with COVID, and we want all children protected. I can't wait till the vaccines become available for children less than 12 years of age, because I am rushing my kids to get the vaccine as soon as possible.
Before I go over to Dr. Coble, let's talk about how schools handle sickness now. I mean, in the fall when schools reopen, thank God, hopefully, what will the school nurse do if you have a cough? Is rapid testing got to be in every school? Are they going to be high on the suspicion list? This could be COVID. How do you think schools will approach this? So
schools should still have the symptom screen. that they ask every day, does your child have any symptoms? And if children have symptoms, they should stay home from school. Sometimes, obviously, these symptoms are ubiquitous. Some people may think that they have allergies and come, some children may end up going to school with an upper respiratory illness, think that it's allergies, but it could be COVID. So I think there should just be a very low threshold for testing. I think schools should have the rapid tests at their school. I feel like parents should go to their pharmacies and pick up the rapid test just to be able to test their children at home. These rapid antigen tests are very effective when children are symptomatic. They're not very sensitive when there are no symptoms. So, I think they're a great tool to have to make sure if a child does have congestion or some cold symptoms, just to quickly give them a test to make sure that they are COVID-free and not transmitting to others. So I think testing should be readily available to everyone, and that people should not come to school if they're feeling sick. And the screening should definitely occur every day for every student and all the staff.
Dr. Coble, what's it going to look like coming back to school? Take me through the different age groups: preschool, elementary school, high school, colleges. What's going to happen? I mean, there's a lot of anxiety over it.
Yeah, and I do think, certainly depending on the age of the child, really what to anticipate with their return to school. I think one of the things that we're telling our families and, our patients as they're coming in for their summer visits is really anticipating that there will be some anxiety. You have to think that there are some kids that have never stepped foot in their school. Maybe they made the transition from middle school to high school and they only did it remotely. So they're going into new physical spaces and new learning environments. So I do think part of what you can do at any age, and certainly in language that's appropriate for the child, is just talking through what does it mean to go to school, and sometimes even going through the physical steps of walking or driving or taking a stroll to the school, so that the younger preschool age children can see the building, the outside. There are going to be new faces there. Getting, especially those young children that may have spent a lot of time at home, getting them comfortable wearing a mask throughout the day, really normalizing that as a part of a necessary attire when they go to school. They're wearing shirts and jackets and socks and pants and undergarments, and you're wearing your mask. And I think for those younger children, for families, as much as you can, doing that pre-preparation, talking about what it looks like, and role-playing and modeling that behavior is really good for those younger kids. For some of the more older school-age kids, you want to do some of those same elements of preparing about the day, but also in letting them know, anticipating things may change. So we're going in person, and the hope is, our 6 to 11-year-olds are going to be in person and they're going to be there for the year, but things may change. And so having contingency plans, if the school or if there is a potential exposure in the classroom, having alternative ways to care for the kids, and talking through the school with your school about what does an alternative day look like if the school is closed for some reason, and really talking through kids at that age, because they can be very, very concrete. And so having that plan and almost anticipating that there may be some changes in the schedule, and really getting those kids prepared in advance. And then really for the high school age kids, which are my patient population, they have seen so much of this. They have taken in a lot of information, and many of them have a lot of their own opinions about how things have been handled. Certainly, we're hoping that those adolescents who are 12 and older have been vaccinated and have had real conversations about vaccination if they haven't. And really, I encourage parents who are on the fence, really include your child in that conversation. But I do think for those high school age kids that can be vaccinated, really thinking about vaccination as an important piece to get them into school so that you can feel more comfortable, certainly if there are potential exposures, that they do have that added level of protection. And then again, just also, for those older adolescents, really talking through and making sure that they have, other ways that they're going to make sure that they keep themselves safe with their friends, and all the other things that we talk about as pediatricians at our well visits, wearing helmets when you're riding bikes, but wearing masks and things like that to give that added protection. But I think a lot of families really should spend some time this summer really talking through what going back to the school year is going to be. A lot of excitement, but there may certainly be a lot of anxiety and some uncertainties, and just being prepared, I think, in a way that we hadn't been before the pandemic. And partnering with your pediatrician really for those well visits to get some shared language and also materials to equip both the parents, guardians, and the kids to have a very successful and productive academic year.
Okay, now get ready for a really tough question. Hold on to your chair. You're not going to be able to answer this, but I want you to try. Dr. Fauci and Dr. Ashish Jha, two world leaders, have been on Dr. Radio talking to me last year. They've both been on multiple times, but they both agreed with me that a college is was a natural quarantine situation, and we all felt that maybe colleges should have been open last year because, you could isolate, you could test, you could quarantine at the college, but they weren't open. So now they're going to be open, and here's the tough question. And probably Dr. Leiter will agree with this enormously based on what she said so far. We think everybody at the college should be vaccinated, period. But the college is going to try to do that. I mean, I have to tell you, Dr. Jha told me Brown is going to do that. Brown University is going to do that, and I'm fine with that. But there's going to be a big struggle and debate over this. So take me inside a college where 90% of the people have been vaccinated, but not 100%. What's it going to be like? Are people going to be marginalized? Are they going to be afraid? How's a college going to operate if 100% of the students in an away school huddled in dorms where COVID could spread easily with the Delta variant flying around? I told you this was an impossible question. How are they going to handle it?
People that are vaccinated, when they do get breakthrough infections, they transmit half as likely as people that got COVID that were not vaccinated. They have the potential to transmit. We know that now from data that came out from the UK last month. But as far as if the exposed person is also vaccinated, I think it would just be extremely unusual if a transmission event occurred at that point. When you do have, nearly everyone vaccinated, it's very safe. And those are the moments that I don't see the need for face masks.
It's almost like a community immunity within the school.
Yes, it's almost its own bubble. I do think colleges should mandate vaccinations because that will actually just keep everyone safe, not only the individual, but everyone. It will reduce the burden of COVID in that entire community. And, you see that just, in different regions in the United States. In New York City, close to 70% of adults are vaccinated, and our infection rates are extremely low, just with that 70% of adults. That's probably about 58% of the entire population, because obviously children are in there as well. Our infection rates are much, much, much lower than other areas of the country where they have much lower vaccine adherence rates.
Chanel, could you talk to me about what college is going to be like? What's college life going to be like?
Yeah, so, this is certainly my time where I'm doing lots of college forums. It has been interesting that many colleges, private universities, have been requiring vaccinations to dorm on campus. And so to really participate fully in the college life, living on campus and campus community housing, many universities have made that stance, to have those students that choose to dorm, have a vaccination or proof that they cannot be vaccinated. And I think with that added in layer of safety for those people who are vaccinated and choose to live in housing, that there will be opportunities, as Dr. Leiter has shared, where people can go unmasked in those public spaces there. But it does really set up a scenario where people who are not vaccinated, for some universities, will have to get their own housing, and so we're going to have some disconnection, from their campus. They'll be able to go. And it's interesting to hear how university is going to handle, when they're in classes. Many of the universities, at least from the few that I've been able to do some forms, they're requiring vaccination to live in their housing, but to attend classes, everyone has to wear masks because, a lecture hall with 500 students, they don't have time to go through and check who's vaccinated and who's not. But I do see, potentially maybe some people who are on the fence about vaccination may be swayed by a little bit of some good peer pressure to get vaccination so that they can actually fully engage in their community as well as in other extracurricular activities. So I do see, in particular, the college environment maybe a place where we will continue to see higher rates of vaccination, certainly because of the ages of the population, and many of them are able to consent independently without parent or guardian, but then also really as an important added layer of safety to really fully engage in college life. And so for those that don't get vaccinated, their college experience may very well be different, and certainly something that we'll have to account for, how to support those individuals who choose not to be vaccinated, at schools that are requiring vaccination to live on campus. So more to come. But certainly the college students do look like a promising group with their high rates of vaccination, especially those dorming.
Dr. Leiter, talk to me about the difference between one kind of mask and another, because we've never really gotten a good consensus on that. I mean, I wear an N95 in the office, a little uncomfortable. The rubber bands are always breaking. Out in the world, we don't think cloth masks work that well. Surgical masks work better. Maybe KN95s work better. I don't know what you think of that. But what should kids in school be wearing? What kind of mask?
I think surgical masks are appropriate for kids in school. We do know that kids do transmit less. I feel very comfortable just with surgical masks alone. An N95 or K95, they do give you that seal. They are used to prevent airborne transmissions. A surgical mask is predominantly used to prevent droplet transmissions. Those would be the germs that are in the droplets in the air. So they usually just fall to the ground nearby where the individual is, as opposed to airborne that can linger in the air longer and travel further. COVID is predominantly droplet transmission. We do know it can be airborne, especially from super spreaders. I would suspect that in most cases surgical masks are just fine. There's data to show that cloth masks, single layered, are not very effective. You would need to be at least double layered.
When do you think the vaccine, Dr. Leiter, is going to be available for those under 12? I know Dr. Spearman's been on the show a bunch of times. He's studying it out in Cincinnati. We've talked to Dr. Offit and Penn about it. When do you think it might actually be available?
I'm presuming that Pfizer will apply for an amendment of their EUA in the early fall. They'll have enough data. In the summer, the infection rates were pretty low. They're now increasing because of the Delta variant. So to really prove efficacy, you are relying on that data. But it is possible they just may need to show safety and not necessarily efficacy. We do know that their vaccines already in the adult population are extremely effective at preventing infection and severe disease.
Dr. Coble, we only have a couple minutes left. Do you think the schools are going to be able to hang on and stay open with the Delta variant flying around? Are we going to be able to do this? Is this going to work?
I really hope that we do. I think we've learned, a lot through shared experiences over the last, it feels like forever, the last year or so. But I do think prioritizing keeping schools open, with high vaccination rates, among our adolescents and young adults and our educators and other support staff are going to be really important pieces. I think if we go into the school year realizing that keeping schools open in some capacity for the entire year is really such an integral part for the health and well-being of our children, and keeping that at the forefront, we will figure out how to do it even despite the Delta variant. But it really is going to take a lot of, I think, more important work by the adults who are choosing not to be vaccinated, or those who are not vaccinating their eligible children. I think are going to be such important pieces to keep schools open. And my hope is that we'll be able to keep schools open and keep kids healthy and safe throughout the year.
Dr. Leiter, final thoughts? By the way, every teacher should be vaccinated, right? So that's for sure. We even touched on that. It should be mandatory for teachers. Final thoughts. We have a minute left.
Final thoughts would be schools should be open in person for all children. Everyone should get vaccinated. Again, being vaccinated protects yourself from COVID. And with the Delta variant, I'm very concerned that most people will end up getting COVID if they are not vaccinated. But, getting vaccinated also protects your family, and it protects the people that surround you, the immune-compromised people as well. It's just the right thing to do.
I want to thank my guests, Dr. Jennifer Leiter.
Thank you so much for having me.
and Dr. Chanel Coble. Chanel, thank you so much for joining us today on Dr. Radio on the Back to School special.
Yes, thank you so much for having me. Really enjoyed the afternoon.
Get facts, not fear, from SiriusXM's Dr. Radio, presented by the leading experts from NYU Langone Health. To learn more about Dr. Radio, including shows and schedules, go to SiriusXM.com/Dr. Radio.